Hello Facebook, hey Instagram, it's Erin with Simple Purposeful Living, and I am so excited today because I'm joined by somebody else in my living room, which is always so much more fun. You guys love when I have guests, and you guys have been asking for months about my chiropractic care and why we started that journey, and so I thought, well, rather than just me explaining, because I'm not the expert, I'd have my chiropractor, Dr. Jennifer, on. Hey friends, as you're joining, go ahead and say hello. And if you have any other questions we don't get to in the live, we will make sure to answer them. I'm going to put this all in a blog post next week so that you can refer back to it. But anyway, I wanted to share a little bit about how I got started, and then I'll have Dr. Jennifer introduce herself. So I actually got started with chiropractic care and acupuncture. Actually, after our second daughter, I had unexplained acid reflux, and they put me on medicine during that time, and then I couldn't get off of it. And I was like, I'm otherwise healthy. I don't want to be on medicine for the rest of my life. And so I started to see an acupuncturist. And then I had trouble getting pregnant with Lucy. And so I started to do chiropractic care and acupuncture for that. And, the Lord blessed us with another child. And then I actually started seeing Dr. Jennifer because Lucy was breech. And you are qualified, or your certification is in Webster technique, and actually you were able to successfully flip Lucy to a natural birthing position. And if you're not aware, I have a high risk pregnancy where I have a blood disorder, so it's much higher risk to to deliver via C-section. So it was really important for me to be able to flip her, and we were able to do that naturally. And I have to tell you, she was my easiest birth by far. Yay. Yes, and I give her all the credit. It was amazing. She got me all ready to go. Lucy by far was my biggest baby, but my easiest birth. And she came out the right way. All my other babies came out sunny side up. Anyway, that's enough personal information for one day. But then, so I was seeing you, but none of my family was. And about that time I thought, you know what? I have seen such great improvement in my anxiety. Just postpartum, I did so much better after Lucy, seeing a chiropractor, seeing you. And then about that time, my husband started to not be able to tie his shoes, bend over to tie his shoes. And he was like, maybe I should see Dr. Jennifer. And that was about 3.5 years ago. And we have been seeing you weekly ever since. So anyway, that's kind of our chiropractic journey. I'm a firm believer in it. I didn't grow up going to chiropractic care, but I have seen huge benefits in my kids and us. We rarely go to the doctor anymore. Like literally, I think one sick visit for each kid like in the last 2 years. I mean, amazing. So anyway, okay, so enough about me. Anyway, Dr. Jennifer, tell me about how you got into chiropractic care, a little bit of history.
Yeah. Well, I wanted to be a chiropractor since 6th grade. It was what do you want to be when you grow up project back in that elementary school, and I just always wanted to help people. I always wanted just to serve and allow people to just live their best life. And I never liked going to the hospitals. I never liked blood or needles. I never needed eye or glasses, so I didn't really have a connection with there. And dentists, I just was never a big, no one wants to go to the dentist. Well, I
don't want to go to the dentist either. No, you're in good company. No, we love the dentist, but we don't want to maybe go to it.
So we had a good family friend that was a chiropractor, and I just asked to shadow him for a while. And I absolutely loved going to his office, seeing people come in with stress on their face or with pain in their heart or in their body, and leaving with a smile. They all wanted to be there. They all wanted to go, and they all left maybe a little better person or a little bit joyful, a little less pain. And so ever since
my experience,
So that was just I just took that to heart, and so ever since then I just always wanted to share that with other people, and so throughout my life, my younger years, I had opportunities to continue to grow that passion of mine, and I got to study in undergrad. I got to go to Europe underneath a chiropractor before I actually went to chiropractic school, and so I just had a lot of different opportunities to really mature that childhood dream, and now get to live my dream. Now, one incident in college, I played tennis in college, at Central, and I had 3 disc herniations lifting, and the medical doctor said I would have to have surgery. So in my 20s, I was told in one day that I would never play tennis again, and I would have to have back surgery. And I broke down crying, and I was like, oh my goodness, my life is over kind of thing. But I had great support. Through that time, I learned and got to know some chiropractors, and they said, no, I can help you. And I actually drove from Pella to Ankeny 3 times a week to see, ironically, Chris Renzi, who's a chiropractor here in town. I adore him. He's actually from Carroll as well. And I went to see him 3 times a week for 3 months, and he got me, feeling great and never had to have surgery. And so I took that passion and his techniques and the techniques that I've learned throughout, education and schooling to make sure that no one has to have that surgery or that lack of hope.
That's right. Well, remember last year Lucy fell and hurt herself, and she wouldn't walk, and you helped her. I mean, it sounds, but you really did help her walk again, and she's doing great. Yeah. But I took her in like one day. It was like, she's not walking. Help her. Nothing worse than a mom to see that. So many great things. Okay, so you guys submitted questions. So we're going to kind of get to those. So can you fill us in a little bit exactly what is chiropractic care?
Yeah, chiropractic care is taking the nerve or the interference from our bodies and allowing our body to perform optimally. I wrote down that your whole body is controlled by your nervous system, coming from your brain, going all the way down, and it functions not only your muscles and joints and your bones, but also every nerve and cell that's in your body. So just like going to the dentist, I love this analogy that when you have a toothache, typically that's not the first time you go to the dentist. Typically, if you have a toothache, that's probably on the last ends of it. You probably have a cavity, or there's probably something else going on. So just like chiropractic care, just because you can't see your spine, you want to take care of that spine, because typically when you have pain or that back pain or headaches like that, that's where the pinched nerve comes into play, and that's farther along than...
It's almost like we like to, in Western medicine, almost treat the symptom rather than the root of the problem.
Yes.
And chiropractic care kind of gets to the root of the problem.
Exactly. That's where I was going to go. That next
question.
Oh,
well, sorry. Darn it.
No, it's okay.
You're such a good educator. I knew that.
Yeah. So exactly right. Is that I believe that chiropractic does is treats the body inside out, and then Western medicine or the traditional medicine, we treat outside in with surgeries or medication and such things like that. Chiropractic looking at the root of the cause internally and allowing the body to take that, the root or the origin of the problem and align it so that everything around can function optimally.
Awesome. Okay, and then let's see, we kind of talked about that. Now, does chiropractic care replace regular Western medicine?
So I love this question because it doesn't replace anything. I think there is a place for everything. Every healthcare profession in our culture, in our community, I think that there is a place for everything. But here's where I love to, when I speak, I say on this analogy that if your house is on fire, there's an emergency situation, you're going to call 911, you're going to call that fire department, you need that help. So then they put the fire out, they're ready, and everything's good, everything's stabilized. So you need surgeon. So in life, if you have emergency, you're bleeding out, or there's cancer, whatever it may be, you do need that emergency situation, or you need that medicine, that beautiful technology that we have in America. However, if you just need to repaint the walls, or if you need a light bulb change, you're not going to call that same person. You're not going to call them, their surgeon, or, well, in that situation in your house, you're not going to call 911. So in life, in our bodies, if you have, a stomach ache or a fever or, whatever it may be, something smaller element, you don't go to the surgery, or you don't have to run to get medicine all the time. You can actually look inward and go to a chiropractor or massage therapist or, PT, looking more health, and then you actually are, making your body even stronger in that sense, and that foundation is even stronger. So when, maybe another damage occurs or that light bulb goes out again, it is actually, stronger.
Yes, I love that. Very good. Okay, so as a chiropractor, what is your certification and what is your medical training?
Yeah.
What does that look like?
Yeah, so I went to 8 years of college, 4 years in undergrad at Central, like I said, and then 4 years additional to chiropractic college.
Okay.
Most people in Iowa go to Palmer, which is a beautiful school. I am originally from Iowa, so I chose to get out of Iowa for a little while, and I went to Kansas City, Overland Park, Kansas. It's called Cleveland Chiropractic College, so that's another 4 years. And then within those 4 years, we have lots of hands-on training, internships, preceptorshipping, and then even through that, we have to be board certified.
Okay.
We have 5 boards that we take that has a lot of medical and obviously chiropractic.
Very good.
Yeah.
So certified, just like any other medical doctor.
Everything medical.
You have all that
board
background.
certified.
Yep.
Certified.
Yes.
Very much so.
All right. So this is a big question because you could probably list 1,000 reasons, but why would you see a chiropractor?
Yes.
We kind of touched on a few.
Yep.
Injury, anxiety.
Yep.
I know my kids and I have seen you for seasonal allergies. What other kinds of things?
Yeah.
would
So
you...
most people, especially men, like your husbands, they come in for low back pain or their neck pain or whatever like that, or computer work. So that's where most people come into the door first. Then they start noticing there are different changes and stuff. Such as we'll start with babies with latching, with nursing, colicky babies you see all the time. Now I don't say that chiropractic cures anything. We allow the body to work together, and it helps care for the baby or the child or the adults and stuff like that. So anything from reflux to ear infections to constipation to growing pains, or in the little bit older kids, attention and focus is a huge patient base for me. And then when you get into the adults, like we talked about, is anxiety and stress, but also even into that fertility and hormonal stuff. I do a lot of women, or have a lot of women and children in my office. But even recently, I've had a lot of people with dizziness and heartburn. We talked about, but even high blood pressure and stuff like that. So anything that the body can control internally, chiropractic can adapt to.
And I saw the other day a quote in your office that said, chiropractic care just really restores the body to that optimal health. It's really, you're just trying to get the body to do what it knows how to do, and just kind of get rid of the interference, right?
Absolutely. Okay. I say all the time that chiropractic, we can allow your body to fight the, any seasonal allergies we talked about. I think that's another question. Yeah. And to be the best mom or best friend, a best wife you can possibly be, because just like getting a good night's sleep, you can perform better. That's with chiropractic too. Internally, if you think of good adjustment is just restoring everything internally too.
We all look forward to our weekly adjustments, and sometimes I visit her more than once a week. I'm always it's been a stressful week. I'm coming back for round 2. She's always happy to see us.
Yes.
Anyways, Dr. Jennifer knows me well. Okay, so let's do. Okay, we kind of touched a little bit on this but a lot of people wanted to know, would I just see you for injury care, or is it somewhat preventative care?
Oh, sure, absolutely. No, there are injuries all the time that we have. If it's sporting injuries, this awful winter that we had with car accidents like that, those are all things that chiropractic can help with. But a lot of my patients do come in because of an injury first, but then they come and they stay because of the fact that they feel so much better with the adjustment, if it is stress or anxiety or sleeping better or whatever it may be. But yes, it is preventative in the sense that studies show that a single chiropractic adjustment can boost the immune system 200%.
Wow.
And so that is comparative to all medicine and all surgeries and all that stuff. So just in that alone, allowing your bodies to be boosted that much can help with anything.
Wow. Do you see better results with regular care, repeated over time?
Everyone is a little different. Maintenance care in my office can be once a week, your family does, up to once a month or even once a quarter. Okay. It really depends on how the family's activities are and how active they really are. If it's with sporting and younger kids, obviously with a little bit more germs, to those more just couples that kids are all grown, like they don't really have a lot more going on and sitting in bleachers all day long and that kind of stuff. So it really depends. But yeah, absolutely, it compounds on, just like going to the gym. You don't see results of a six-pack abs the first time you go there. It's actually just like chiropractic. You actually get healthier and healthier every single time you do go.
I just heard a quote yesterday by John Maxwell, and he said consistency compounds. So you might not see it right away, but over time you start to see that consistency compound.
That's beautiful.
Okay, so this I thought was a good question. Will children's body become looser and pop out more easily if started chiropractic
I love this
earlier?
question because I get this a lot. I see a lot of little ones. Actually, it's the exact opposite. So when kids are growing and developing so quickly, they're constantly, these nerves firing, these nervous signals are growing. When they are in alignment, their bodies are actually allowing them to grow stronger and better and faster, in the sense that are more aligned. Muscles are stronger, bones are stronger, the joint space in between are actually stronger. Because if something is off, then the body has to constantly try to fix it, because God made us perfect. And because of childbirth, everyone knows that it's not easy. And so it's not easy on the baby either. And so during those different outside events, it can pull the child's alignment off. And then with chiropractic care, just a very, very light adjustment. People think that chiropractic for adults, like a grown man to a baby, is the same techniques. They're exact opposite techniques, very different techniques. And so it's completely different. But yeah, absolutely, it's actually the exact opposite. They are stronger and don't pop as much, or whatever people call it.
Well, and I think too, like my kids hop up onto the table. They love you. Like they're just like, yep, I'm ready to go, because they know they feel better too. But as a mom, I mean, you're so gentle and caring, and it looks different. I haven't felt it because I haven't been a child, but like it looks different than like what we would experience as adults. Although you're very gentle with us as adults too, very gentle. I think people think of popping and cracking, but it's very gentle.
Yeah, I like to call it the female finesse.
There you go.
I use the body's finesse, and the body's, you don't necessarily have to show your strong muscles.
Just kind of very gentle. Okay, so let's talk about, is it expensive, and what happens if your insurance doesn't cover it? Now this is probably dependent on practice and things, but you can kind of maybe touch on that a little bit.
No, I actually think it's cheaper in the sense that you don't have, if you go into chiropractic care, just like, you guys experience, like you don't have to go to the doctor anymore as much, and the medicines go down, and the cost of all that offices is go down. So no, in the long run, it's actually cheaper.
I would agree.
And actually, insurances are now seeing that. United Healthcare has a new study out there, or a new thing out there for all the providers. They actually are seeing it, that they're making their clients, most of them are going to chiropractic before they do surgeries now. So not only is family seeing it, but our insurances are seeing it. So I think in the next couple of years, we're going to see a big switch on that, because insurance companies are saving money too. Because the surgeries are expensive. What was the second question? So now I don't think it's as expensive. Oh, what if if your insurance doesn't cover it? Most insurances do cover it now. I think there's only a few that don't. But in my office, and I know that a lot of my friends, chiropractors around the Ankeny and Des Moines area, we make it work. We make it work. Since I wanted to be a chiropractor so little, I've seen it that people can't get seen because of finances. So I always, in my office, there are different forms you can be made, and different hardships, if that's the case, to be had. Legally, you can put different packages together and stuff like that. So in my office, we definitely make it work, because I believe that everyone deserves to feel good, to live an optimal life, and to be the best mom or friend or anyone that you be. So.
And for us, I mean, yes, we know it's a priority, and we've seen that, like, our money, we've saved money, obviously, in so many ways. I think Scott didn't have to have surgery for his back, and we aren't on any medications. I'm not on that acid reflux money. All those things that we were probably going to have to pay for, we're not paying for anymore. So definitely just a shift in perspective. Okay, so two kind of questions we're going to go with. What does it help kids with? I mean, obviously we kind of talked about a few of the things it's helped my kids with, but what else?
Yeah, gosh, anything. My kids were adjusted when they were minutes old, and I know my daughter actually was born not breathing, and so obviously after oxygen and stuff like that, with her, we call it a vagus nerve. It's her C1 atlas adjustment. I adjusted her. And she started breathing regularly. That's obviously like a extreme situation, but in just normal, I would say the most commonly stuff for kids is they're just falling up and down all the time, tripping. Now it's biking season and being outside like scrutinies. Anytime they fall, they can jar things. Now with routine chiropractic care, their bodies are stronger because of it, and they don't have to go back to being misaligned all the time. But anything from falls and scrapes, but also to attention and seasonal allergies, I think we touched a little bit about, but attention with school is a big one in my office. People are saying now ADHD is just becoming a whole new thing, a whole new realm of bigger and bigger thing. Autistic kids are in my office all the time. Anything.
Sleeping. I think
sleeping,
we've seen
yes,
huge,
quality of sleep. That's
huge
good.
benefit in sleeping. I mean, as a mom, you're like, please just allow my kids to sleep.
Yes. And I also even see the attitude and patience, just like me getting adjusted. I feel like, wow, I can adapt to stress or just be more patient with my child or my kids and outside life. But same with kids too. I feel like they can adapt to different, like on the go. We have they're not so defensive on that.
And I love it too because my older two, especially now, they've become so attuned to their body. Like they'll come in and they'll say to you themselves, like, hey, this is a little sore or this is not feeling. They've become really aware of their own body, which I think is an excellent
it feels
byproduct.
Good. Yes, absolutely. It feels good to feel good is what I always say. And little kids, to teach them that little on, they don't have to grow up into just living with it. It breaks my heart, like, oh, I just have a headache once or twice a week. I just live with it. That's normal for me. And I'm like, no headaches are normal.
Yes.
No pains are normal. And so you don't have to live with that, no matter what it is.
That's awesome. Great encouragement. Okay, is it safe to do during pregnancy? Oh, I did it during pregnancy.
Yes. That's one of my favorites. My passion is I don't know what I would do without chiropractic during my pregnancy. I had a 10-pound baby, so I needed it. But yes, absolutely it is. Like Erin said, I am Webster certified. A lot of chiropractors are, but it is additional training. It is additional, like a couple years of training on pediatric and pregnancy training. But yes, absolutely, it is safe. It is encouraged. Studies show that it's easier and faster deliveries. They don't get stuck at a dilation. Typically, moms, the most common is getting stuck around that 4 to 6 dilated, and that's when they have the epidural, and then they have to get C-sections afterwards. But if you go in with chiropractic, you don't get that stuck or that dilation. You progress better and faster and quicker. As well, a lot of patients come to me like, how do you adjust a pregnant mom? How do you lay her on her belly? In my office, I have different pillows, pregnancy pillows, different like that. But also, I adjust people sitting or on their side all the time. And a lot of it is with the abdominal too, so you can do it on their back as well.
And you really helped me afterwards too, because Lucy was so heavy with my pelvic floor too afterwards.
Healing that all
too, right? There's wear and tear on the mama body.
Abdominal muscles, pulling them back together, all that stuff with chiropractic. That goes back to the nervous system and going back to like allowing those nerve signals to be, optimally healing and growing it back together.
Yes. Yep. That's all good. Okay. Okay. So we're gonna kind of wrap up. We've talked a little bit about allergies and it can help with that. So, how can you find a good chiropractor?
Yeah, okay, so obviously social media is so big right now. You can always go on social media, Google and that stuff. However, I think that it's even more important is just talk to your best friends or your family and friends. My office, I always say the highest compliment I can receive is a referral of a family and friends, because that means they trust them or trust me and with their health. So talking to other family and friends that know you, because there are so many different chiropractors out there, and it is okay if one isn't a good fit for you. You can go to a different one and finding that best fit for your family, if it's gentle or the techniques, if it will be, or just the overall mentality of health. So I always say referrals. I always say asking friends and family where they go, or of course social media. But
So is there anything that you would like to leave people with about I mean, obviously we both love chiropractic care.
Yes.
Is there anything you would like people to know that they might not know, or any myths that you'd like to dispel about chiropractic
Gosh,
care?
I just think that I just want to encourage people and provide hope that if you have a doctor that has told you that you're not going to be healthy again, or you're going to be on this medication again, or you're going to have that surgery in 6 months or a year or something like that, to look elsewhere or to get a second opinion, because you know, that's what I believe chiropractic is that it provides hope but encouragement, because it does look so deep into the spine and allows you to perform, because everyone deserves to feel good. Everyone you know, deserves to be the best mom and best wife and best friend they can be. So I just encourage them to take matters into, you know,
be an advocate for your own health.
Yep, exactly.
Yep.
Exactly.
And that's kind of how I found chiropractic care. Like, hey, this is what they said, but I think that there's a better way.
Absolutely.
And
Absolutely.
I'm so thankful. So anyway, thank you so much, Dr. Jennifer. And you can find her at Natural Health Chiropractic Care. I just call her Dr. Jennifer.
Yep,
so,
chiropractic
but I will
care.
take her on Facebook for sure, and on Instagram you can message me, and I will make sure to get that if you're local. So anyway, we are so thankful. Thank you so much. Hopefully that encouraged you to kind of just broadens your horizons about chiropractic care. If you have any other questions, be sure to message me, and if I can't answer it, I know where to find her. I'm in there all the time. All right, have a good day. And always keep on keeping on with a simple, purposeful life.
Yes.
So, thanks.
Yay.